Hi, my name is Scott Turton. I'm a therapist with Gosnell Thorne Counseling Center on Cape Cod. Recently, I've been integrated into a primary care medical practice. The practice that I've been in goes by the name of Pleasant Lake Medical Practice in Harwich, Massachusetts. This has been an exceptional experience for me. In doing this integration, have come to understand that it takes a certain type of therapist to come into a primary care office. And the type of therapist I'm thinking of is a therapist that has a flexibility in understanding the way that I've done what I've done in the many years of my career doesn't necessarily translate well into a primary care medical practice, i.e., I can't sit with someone for 60-minute sessions. I can't see those persons for months on end. Develop a treatment strategy that is a longer-term based treatment strategy. Well, all of those techniques and structures are really very good for a therapy practice, maybe a private practice, or even from an agency perspective for complex patients. They don't necessarily work very well in a primary care practice where patients are seen in a rather rapid fashion, seeing the primary care doc, and then maybe brought over to the behavioral health provider to either check in on how they're doing with their moods and their various different functioning abilities, or a crisis situation, or in the primary care perspective of just managing what's happening and developing a fairly quick, more concrete outcome for the patient due to either medical concerns or behavioral health concerns. So I've had to sort of throw off a variety of ideas around what my therapy practice is all about in order to be more effective in a primary care practice. I've come to understand that the collaboration with the primary care providers is absolutely essential in making this a success. One of the things that primary care providers have told me while being integrated into this practice is that they have in the past not had great communication with behavioral health care providers. Obviously, those behavioral health care providers are outside of their primary care practice, and so getting information, receiving information, or even attempting to communicate with the provider themselves in regards to share a patient is somewhat difficult experience often. This, of course, gets alleviated if I'm embedded right into the primary care practice and I'm able to consult face-to-face with the provider, but I'm also able to send my clinical notes directly into their electronic record, which we've set up at this particular primary care practice. So there are a lot of benefits, I think, to integrating into a primary care practice for behavioral health care providers. It is exciting work, it's fast-paced work. It forces me as a clinician to be much more concrete, much more goal-oriented, solution-focused oriented, and it forces me into understanding the importance of collaboration for patient care and how I might look for many avenues to do that, because I am understanding through this integration that the more communication amongst providers, the better it is for the patient and the better the patient outcomes are. So those are just a few thoughts around my personal experience in being integrated into a primary care practice.